कॉफी घेते तुम्ही? सर याला थोडं हाईटवर घेतलं पाहिजे.
Together with Symbiosis University Hospital and Research Center, along with Symbiosis College of Nursing, for Emvidya, Nursing Training Academy. A knowledge-enhancing together with Symbiosis. This series is specially designed for your nursing and paramedic staff. Along with Symbiosis College of Nursing, for Emvidya, a 12-month series which will cover various mother and child care modules like antenatal care, labor process, postnatal care. It is a one-of-a-kind series which will help you better your knowledge, problem-solving skills and commitment to patient advocacy. Each module is meticulously prepared by the experts at Symbiosis University Hospital and Research Center. Learn and interact with the best.
Away from the hustle bustle of Pune, in the quieter environment of Lavre, stands the majestic campus of Symbiosis University Hospital and Research Center, SUHRC, a retreat hospital. Sprawled over 40 acres, the hospital campus houses an 866-bedded multi-speciality hospital with over 20 specialties. For over 50 years, Symbiosis has been imparting quality education to students across the globe. Drawing strength from this trust, Symbiosis University Hospital aims to redefine healthcare in Pune through its evidence-based clinical care. Taking forward the philosophy of Vasudhaiv Kutumbakam, the world is one family, SUHRC believes in inclusiveness across all strata.
At the Symbiosis University Hospital, our goal is to provide the best of patient care through our team of well-trained healthcare professionals, supported by the latest technology and excellent infrastructure.
We have specialists in cardiology, nephrology, neurology, gastroenterology, and other surgical specialties. SUHRC offers comprehensive care to patients through a full spectrum of medical and surgical services with the latest state-of-art equipment. At Symbiosis University Hospital, our endeavor is to send back happy patients by creating a homely environment by going beyond the call of our duty and thus have happy faces, smiling faces at home and in the hospital as well. At SUHRC, healthcare goes beyond infrastructure and facilities. we make qualitative difference to one's life and health through patient-centric approach. It is beyond call of duty for all of us. SUHRC, one family, one hospital.
Symbiosis College of Nursing is in the very beautiful campus of Lovely with SUHRC Hospital above the College of Nursing. The Symbiosis College of Nursing was commissioned in the year 2007 with the goal of preparing global nurses and placing them across the world with one philosophy of symbiosis, that is, world is one family, Vasudhaiva Kutumbakam. The college is spread across 39,424 square feet with all the facilities of labs and classrooms. Technology, the latest skill facilities have been provided in Symbiosis College of Nursing. The Symbiosis College of Nursing is manned by a very well qualified nurses handpicked through a very stringent recruitment process. Symbiosis College of Nursing proudly presents 12 faculty members who are pursuing their PhD at this point in time, with 4 PhD members already on the board. And the Symbiosis College of Nursing prepares nurses in the lab and thereafter in the parent hospital, that is Symbiosis University Hospital and Research Center. So have a big bandwidth of international students, strives hard day by day to give a wonderful nursing care both in the hospital as well as in the community. Symbiosis College of Nursing will always strive to do the best that can be done for the patients and the families in the community, thereby coming with a tender, loving care of nursing.
Hello everyone, a very good afternoon to all of you. I, Dr. Kaveri Adgi, on behalf of entire team at Emcure, welcome you to the Emvidya Nursing Training Academy, a unique initiative in collaboration with Symbiosis Nursing University Hospital and Research Center and Symbiosis College of Nursing. The objective of this program is to train and empower nurses with knowledge of mother and child health care. I would like to welcome and introduce our colleagues from SUHRC and ESCON who have been instrumental in the development of successful implementation of Emvidya. Dr. Sonopant Joshi, sir is director at ESCON. Sir is a PhD in management from Tilak Maharashtra University, Pune. Sir has 2 master degrees in nursing as well as in disaster management. Sir has teaching and administration experience of 32 years. Sir is invited speaker for many national and international organizations. Ms. Prezi Varghese is head nursing of SUHRC. She is MSc in nursing, MBA in hospital administration with 20+ years of experience. Mr. Imran Ali Chauhan, He is nurse manager at SU HRC. He is MSc in nursing with 11 years of experience in national and international accredited hospitals and colleges as a nurse administrator. I will take this opportunity to introduce our today's eminent speaker, Dr. Gopal Krishna Gaude. Sir is a MBBS DGO DNB. He is from BJ Medical College, Pune. He is director of renowned fertility specialist at City Fertility Center, Pune. As a part of his social devotion and contribution, he is practicing as a gynecologist and obstetrician at Sardar Vallabhbhai Patel Hospital, Cantonment, Pune for last 8 years. He has performed more than 5,000 surgeries related to gynecology and high-risk pregnancy. Today's speaker is Miss Archana Admute. She is tutor at ESCON. She is MSc in nursing with 1 year of staff experience. She provides clinical, efficient and effective nursing care to the patient in ICU. I request Miss Archana to please start the session.
Thank you, madam, for introducing me. So, good afternoon, one and all.
Stop. Sharing stop कर दो.
Please, ma'am, stop your sharing so we can start our sharing. Yes. So, good afternoon, one and all. So, today in this session, I'm going to discuss regarding psychological support during pregnancy. So, as we know, during pregnancy, there are many more changes occurs in the woman's body, like physical changes and psychological changes. But normally, we always notice on the physical changes and we try to treat those changes only. But we, as a healthcare professional, as a part of our health, we have to focus on the psychological aspect of mother also. So we will see in this slide regarding the psychological support during pregnancy. So as we know, pregnancy as a developmental phase involves both physiological and psychological adaptations that are acceptable to a certain extent. Means this physiological and psychological changes that we should accept up to the little, means up to certain extent, but when it excessive or when it become excessive may lead to pathological changes. So as a healthcare professional, it is our responsibility to note which all are the abnormal changes occurs in the mother's body, and we have to try to cure those problems. So we will see here the psychological stressors during pregnancy. Okay, so during pregnancy there are many more stressors factor present. So we will see here some factors that mostly present. So first is unplanned pregnancy. Okay, so not every couple tries to plan their pregnancy. Sometimes it occurs by their unplanned pregnancy. So that time that woman or that couple goes under many more stressors. So that is also the one of the factor for a stress or one of the cause for stress during pregnancy. Next is a negative experience with the previous surgery. Means the during the previous delivery or previous pregnancy, she might have undergone a miscarriage or stillbirth. So that time she has a negative experience of her previous pregnancy. So she might be worried regarding the outcome of this present pregnancy. So that might be the stressor for that lady. Then next is the physical changes during pregnancy. As we know, during pregnancy there are many more changes occurs in the woman's body. So that there is a physical change occurs, that like the self-image changes, and so that also the cause for stress. And also because of certain hormonal changes that doesn't directly affect on the mood or the emotional level of the mother, but indirectly it affects. Next is the financial difficulties. So here is a point come with her job status, means where she is working, and if when she got pregnant, that time it is difficult to concentrate on the family, means her on health and on her job. Okay, so it might be difficult to manage her finances. So that might be one of the cause for psychological stress. Next is the loss of family member and single parent. So as we know, during this COVID pandemic, many more people has lost their family member because of this COVID-19. So some women might have lost their husband. So during this COVID pandemic, so it might be the stressor for that lady. And next is the lack of knowledge. Sometimes lack of knowledge might be the stressors. So these all are the psychological stressors during pregnancy. So next we will see how this stress going to affect on mother. So chronic or ongoing stress can affect maternal health and or well-being, and can include experiencing headache, problem in sleeping like insomnia, fast breathing, and a racing pulse. So that might be a common problems when she undergoes in a chronic stress, that is headache, sleeping problems or difficulties, and fast breathing and racing of pulse. But there are some other problems like obsessive thoughts, worry or anxiety, anger, eating problem, that lady might be eating too much or too little food. So that is not a good, okay, or the wrong type of food. So trouble relaxing or winding down. So these all are the impact or of a stress on a mother, okay. So next we will see impact of stresses on fetus. So chronic stress could also cause a problem for a baby. If that is an acute stress, means it is for a very little time period. So it is not going to affect on a baby or mother. But if it stays more than 6 weeks of pregnancy, so obviously it is going to affect on a mother and baby. So we will see how it is going to affect for a growing fetus. So this can include effect on your unborn baby's growth and length of gestation. That fetus growth and development might be affecting, and also there is a chance of getting preterm labor, okay. So next is they can also increase the risk of problems in your baby's future physical and mental development. There are some physical and mental development problem also there, as well as the behavioral issues during childhood. So we will see here what all are the objective behind providing psychological support. So pregnant women who lack psychological support may experience stress during their pregnancy and childbirth. So if we are not going to treat this condition or that psychological disturbance during early phases, so it is going to affect or it is going to cause long-term stress, that is a chronic stress during pregnancy and childbirth also. So these changes may increase the woman's vulnerability to depression. So as we know, depression is a very severe form of mental illness. So to avoid this severe form of psychological illness, so we have to treat the mother as early as possible, which may in turn have adverse effect on both maternal and fetal well-being. The psychophysiology of pregnancy need to be understood in terms of adjustment that all women have to make when they conceive as a pregnancy in also adaptive process. So as we know, this pregnancy is adaptive process, means certain changes they're occurring, and that mother has to undergo or mother has to adjust during those changes. So these all are the objective while providing the psychological support to avoid the effect of this chronic stress on mother and baby, and to make mother to adjust with that adaptive process. So here we will see what is the definition of psychological support. So psychological support refer to the action that address both psychological and social needs of individual, families, and communities. So psychosocial support can be both preventive and curative. It is a preventive when it decreases the risk of developing mental health problems. So this is the definition of psychological support. So we have to give support to the mother, that is both in a preventive and curative nature. So it is a preventive when we are going to address that problem or any psychological problem in the early phases. So next we will see psychological changes during pregnancy. So as we know, pregnancy and initial weeks or months are a time for significant psychological changes for both parents. So not only mother going to address all these problems, but her husband is also going to suffer from all those psychological changes. So such a child psychological changes during pregnancy help in the preparation and adaptation for parenthood. Means these psychological changes are also necessary for the preparation and adaptation for parenthood, self-identity, couple relationship, and parent-infant attachment. For all these things, these psychological changes are very important. Means during this phase, the mother and that baby's mother and father going to play a role of parent. Okay, so for that purpose, these psychological changes are very important. So moreover, the psychological state of the pregnant woman is a dynamic and changes fluctuations during every trimester. Means psychological changes are not steady during 3 trimester, but it fluctuating or changing in every time that during this 3 trimester of pregnancy. So, to make sense of the emotional ups and downs during the pregnancy, it is important to have understanding of the psychological changes during this vital period. So, we have to understood which all are the psychological changes occurs and that is good or bad for the woman's health. So, this would also help in detecting and addressing many mental health problems at a very early stage. So, as a healthcare professional, that is our responsibility to address or recognize the that healthcare disorder or issues at a very early stage so we can cure those problems. So sometimes psychological changes could lead to significant stress too. So if we are not going to treat or we are not going to recognize those problems, then obviously it is going to convert into that chronic stress. So here we will discuss regarding importance and need of psychological support during pregnancy. Okay, so it's important to treat mental health concern during pregnancy. Mothers who are depressed, anxious, or have another issues might not get the medical care they need. Okay, because they are anxious and they are not able to take care of herself or her fetus properly. So they might not take care of themselves or they may use drugs or alcohol during this pregnancy. So to handle that stressful situation, they might undergo wrong practices like taking or doing use of any drug or doing use of alcohol. So for avoiding all those things, we have to, as a healthcare professional, we have to provide psychological care. So all of these things can harm a growing baby. So how to provide? Okay, so collection of history at the first trimester of pregnancy is crucial for understanding the psychological state as well as categorizing high risk mother. So these psychological problems or psychological stresses we are going to address on the basis of history collections. Means we have to collect a history regarding her socio-economic background and psychological aspect. So on the basis of that, we might got information regarding her education status or any stressful work environment or adequate or inadequate nutritional status, because all these things are going to affect on her psychology or that mother's psychology. So psychological aspect of history includes inadequate personal, family, and friend support. So if we have a good friend support or good family support, so obviously there is no need of psychological support by the professional. So personal history like use of tobacco, illicit drug use, alcohol abuse, inadequate exercise are health behavior that place women at risk for an adverse antenatal process. So antenatal visits are modified according to woman need and physiological health. While assessing the psychological state, one must consider the socio-cultural aspect also. So his history, that is family history of psychiatric illness. So we have to collect the history regarding psychiatric illness in their family. So all those things we have to consider while collecting the history. So who should provide the psychological support? So when it comes to that who is the one to provide the needs of professional worker who can handle with utmost care and is capable of making the patient comfortable, there must be a psychologist in each obstetrics and gynecology department who should be accompanied by mental health nurse. So nurse, midwife, nurse practitioner, social worker, nutritionist, and genetic counselor. So all these people should be there to provide the psychological support and the information regarding their need. So hospitals should include mental health screening as a part of antenatal checkup. So as we know, during antenatal checkup, there are many more checkup present, but psychological screening is not there. Okay, so we have to include this mental health screening. So mother should be motivated to undergo for screening test without hesitation. Then family member or close relatives, whoever is in contact at a very moment should contact general practitioner or a psychologist if mood changes or disturbance is there. And any information of patient related or psychological problems, that we should not convey that information to any another person. That is, we have to keep it as a confidential. So how we are going to reduce the stress during pregnancy? So it is very important, as we discuss how it is going to affect on the mother and growing fetus. So we have to reduce the stress. So to reduce the stress, mother could try the following: that pay attention to the triggers that make that mother stress and notice what happens when she feels stressed. Try to slow down, rest, and don't put too much pressure on that mother. Then eat healthy, well balanced diet. It is also very important for the growth and development of a baby. Talk to someone who you trust about your concern and how you are feeling. So regarding all those things, she must be discussed with their someone who is near to her or close to her. The next is the physical activity and relaxation can also help to reduce the stress. So take a part in a regular exercises suitable for pregnancy. Do yoga, meditation, breathing or relaxation through classes or using apps, videos or podcasts. So engage in favorite distractions activities such as reading, watching TV or hobby. Spend time with the people who make you feel calm. So all those things, like she has to involve into the physical activity and all those things, and she has to talk with the person who is dear to her. So all those things is related to the psychological support. So it's over to you, ma'am. I stop here.
Thank you very much, Ms. Archana, for informative session. Today's scientific session will be on a topic psychological and moral support during pregnancy comprehensive approach, in which our eminent speaker is Dr. Gopal Krishna Gaude sir. Now I request Dr. Gopal Krishna Gaude sir to start the session. Over to you, sir. You are on mute, sir. Please unmute yourself.
Hello.
Yes, sir.
Can you hear me?
Yes, sir.
I'm connecting the mic. I cannot hear you all because mic is connected. I don't have headphones for that, but I'll just keep on speaking. Once my session is over, if somebody has query, we'll discuss it at the end. Okay.
Yes.
Very much audible, sir. Please go ahead.
Hello, sir. Sorry to interrupt. Sir, you are not audible, sir.
We can't hear your voice, please.
Now we can hear.
Yeah.
Am I audible?
Yes, now. Yes, yes.
Okay. Previously, I was not audible.
Yes, sir. Now you're audible.
Okay.
All
Fine.
is clear.
Okay. Fine. So thank you, Emcure and Symbiosis, for giving me this opportunity. And we are discussing today psychology of lady who is pregnant, or lady who is going to deliver, or lady who is going into a postpartum period where she has to take care of her baby. Now, if you are at her position, what all worries you'll have, that's the main concern. If you feel empathic about the mother, then you will realize all the problems she's going to face, and you will find out the answers also. So, see, pregnancy is a part of your success. I'm saying it purposefully because for every success you want to achieve, so baby is a part of your successful life. It is said that if a woman has not delivered a baby, she is incomplete. So when it comes to success, everybody fear for failure, isn't it? So if that mother is pregnant and she's carrying a baby in the womb, she fear whether I'll complete the pregnancy uneventfully, whether there will be complication in the pregnancy, or whether there will be any problem during the labor or post delivery, whether my baby, I can breastfeed that baby well, that whether that baby will have good IQ, whether that baby will grow adequately with my all my efforts. So these are all anxieties which are, so whenever there is a fear, they'll start worrying about it. So how will I, what is the reason behind this and how will I resolve it? And if that worry become excess, that's called anxiety. Anxiety is nothing but excess worry. And when somebody is having excess worry and couldn't find any answer to it, then they become depressed. So usual scenario in pregnancy is also same. So they are feared about all outcomes of the pregnancy, feared about outcome of the baby, and then because of that they have anxiety, worrying, excessive worry about the ongoing events, and then finally if they don't find solution to it, they become depressed. So these are the usual problems which are faced during pregnancy, and as a nursing staff or as a medical practitioner, we have to address them in terms of finding the root of the cause and treating it there. So root of the cause is fear of unknown, fear of something going to happen to me, something going to happen to my babies, fear of no, and this fear is especially huge when they have experienced bad events in the past pregnancy, or especially when the pregnancy is a precious pregnancy like a IVF pregnancy. They want that baby at any cost because they have done too much of they have invested too much into that pregnancy, and at any cost they want that baby healthy. So this is the problem. So fear, and the fear is usually if I say I have to go to some place, and if I don't know the route and I have to reach there at some time, suppose 9 p.m. I have to reach at some place and I don't know the route, I'm new in the city, I have a car but I'm new in the city, but reaching at the place will be difficult. I'll have a lot of fear whether I'll reach on time, I will miss the event, and I'll start worrying about it, isn't it? But if I have a knowledge about the route, what is going to happen to me when I'm going to encounter what things I'm going to encounter, then probably I'll be comfortable psychologically, mentally I'll be comfortable. I'll not have any fear of missing out the event, or I'll not be feared about any bad outcome of the whatever is going to happen. And so I'll not be worrying about the event, and there's no question about depression, because there is no depression happens usually at the end of anxiety when it is not resolved. So I'll not be depressed. So the main thing which medical and paramedical staff can do about the psychology of the improving psychology of the pregnant lady is to provide her knowledge of the path they are going to follow. Okay, there are many queries in their mind which if they are not addressed on time, then they will have they will have that worrying, they will have that anxiety, they will have the depression if they don't find any solution out of it. Okay, so usual fear is a fear of complications. They have, somebody must have told them, oh, pregnancy means that lady had some bad outcome, the baby died in the womb, baby died up during the labor, baby died after the delivery, or that mother died because of some reason, mother had a bad trauma. And this fear these people around them, sometime in the past they have discussed it, or this lady has faced some abortions or some bad obstetric event in the past, and she's damn scared about these things. So we have to explain them. Actually, we have to explain them complications which might happen, and at the same time we have to explain them what all we can do to avoid them. If they know how to avoid these things, then there will not be any fear or anxiety in their mind. See, if we know something coming to us and we know the solution out of it, if I know that I'm going to have fever in the evening and I know that I have a crocin in my pocket, I'll not be worried about it. Okay, fever, I'll take crocin, my fever will go. Okay, so some amount, they have fear of unknown, they have heard some weird things about pregnancy and outcome of the pregnancy. So we have to tell them that, okay, don't think about rare things. These are the common complications which are usually encountered during pregnancy, and these are the way we can prevent these complications. And if we stress them the ways to prevent this complication, we have to tell some logic behind it, because knowledge to action will only happen if we tell logic behind uh, preventive actions. If we don't tell them logic, they'll not follow it. So we have to tell them about what all can go wrong and how to prevent that. The best, there are three types of complications in pregnancy. There are complications during the pregnancy, there are complications during the labor, and complications after the delivery. So if we deliver them proper knowledge, we can overcome the fear and the anxiety we generate out of it. Give them knowledge, give them preventive methods. We can prevent all these things, and we can calm them psychologically. Yes, we are not going to discuss psychiatric disorders in this, because this is beyond the scope of this short lecture, because psychiatric disorder itself is a big topic. Psychiatric disorders in pregnancy, we're talking about normal healthy pregnancies who are having unnecessary worries in the mind. We have to resolve it, we have to support them psychologically. So antenatally, we are dealing with two patients, baby and mother. And mother is also concerned about her own health also, and baby's health also. So what all can go wrong with the baby and what all can go wrong with the mother, if we tell them common complications, these are the common complications and these are the ways we prevent them. So baby's complications, usual baby's complications are early complications are abortions, anomalies, preterm labor, and growth restricted babies during the pregnancy. These four complications: abortions, anomalies, preterm labor, preterm delivery, that is small babies, and growth restricted babies. Okay. So if the babies are born small, the baby's IQ fall. That's a known fact. So we have to do every possible thing so that the babies are born with the adequate genetically programmed birth weight. Okay, genetically programmed birth weight is the weight decided by mother's bony framework. Okay, so these four things usually happen, and I'll tell you how to prevent all these four things. Okay, in mother, what we all encounter commonly is anemia, pregnancy-induced hypertension, gestational diabetes mellitus, and infections. These are the four major things which can happen during antenatal period, which can have an adverse outcome during the pregnancy. So, four complications in the baby, four complications in the mother. In baby, abortions, anomalies, preterm labor, preterm delivery, and growth restriction. And in mother, anemia, pregnancy-induced hypertension, diabetes, gestational diabetes, and infections, various infections they can encounter. During intrapartum period, they have all those funny stories they have heard, and there is a tremendous pain, and the pain most of the time is intolerable, and they're damn scared about that pain, whether I will tolerate that pain, and because they have never faced that, and the pain is the main concern during the labor. The main worry, main fear is pain, and after that, main other concern is whether I will deliver vaginally or I will undergo a cesarean section. If I undergo cesarean section, that's a surgery, but all complications can happen with cesarean section. I'll be permanently disabled, vagara, vagara. The old people, old school, once a cesarean section, then people used to tell in the past, don't lift heavy weight. And then usually patients were from the farmer class, and lifting heavy weight was the part of their daily job. So they used to feel that I'm handicapped now, I can't do my daily job. So that sort of thing used to happen. So you have to address during the labor, we have to address how to manage the pain and how to manage what will be the outcome of the delivery, what all factors decide that. And if at all you have to face cesarean section, what all things you need to worry about, or what all things you can do about, what all things doctor will do so that you will not have much of a problem. And then in postpartum period, again, mother faces few problems and baby faces few problems. Okay, so intrapartum I told only two problems. Usually they are worried about the pain and what kind of delivery she is going to have, whether a vaginal normal delivery or a forceps delivery or a cesarean section. During postpartum period, usually that's a very vulnerable period for the in terms of a psychology for mother, because you will not believe 80% of the mother will face postpartum blues. What is postpartum blue? Postpartum blue is the mild depression, because a postpartum state is a state where they are suddenly deprived of all hormones. Placenta was producing hormones for 9 months, and because placenta was producing hormones for 9 months, her ovary and pituitary and ovary were inactive completely, and pituitary and ovaries will not become active even for 6 months after the delivery, because high prolactin level wants ovary to remain dormant, because if ovary become active and she start ovulating, she might conceive again. That conception, pregnancy will affect the breastfeeding of the first baby. So nature will stop production of the hormone through ovary for next 6 to 8 months or 10 months, or sometimes up to 2 years in patients who are regularly breastfeeding their babies. So the postpartum period is a very vulnerable period where they are deprived of all the hormones. Placenta is out, placenta is not producing hormones, the ovary is not producing hormone, and there is a huge androgen deficiency, huge estrogen deficiency. Yes, androgen deficiency is a major concern rather than estrogen deficiency, because androgen is responsible for mental health of that lady. If lady is deprived of androgen, whatever androgen is being produced by ovary, then they become depressed. That's called female androgen deficiency syndrome. Okay, and very few patients who are vulnerable might develop postpartum psychosis as well. So postpartum blues are common, postpartum depression, a severe form of depression is common, and postpartum psychosis is also common. In baby, they are worried about two things. One is lactation, whether I can breastfeed my baby properly. I have never breastfed any baby, so whether I will latch it properly, whether baby will suck, what all kind of problems I will encounter during breastfeeding. And breastfeeding, they have heard all good things about breastfeeding, and then they are worried whether I can do breastfeed my baby or not. And then the last problem during the postpartum period is sudden mishaps to the baby. Babies are very weak once they are born. They're very prone for dying because of hypothermia, because of aspiration, because of infections. So what all that lady can do to prevent that? If we tell them all these things, then probably she know what all is coming. She know how to deal with it, and she knows how to tackle it. And at the same time, when she knows the problems and solution out of it at bay, and she will be happy. First, most important thing you have to counsel her is that the pregnancy is a physiological thing. Pregnancy is not something which is pathological, or pregnancy is not something which is going to be dangerous thing. Pregnancy is a simple physiological thing. Most of the time, it uneventfully they finish 9 months, uneventfully they deliver, and uneventfully the postpartum period is over. So this first assurance you must give. Then in early pregnancy, there are we in our clinics, in my OPD, I usually tell them do's and don'ts, which will take care of anomalies, do the anomalies we usually screen, but we usually we tell them a few things, important things, so that there will be no abortions in pregnancy, no preterm labor, no growth restriction, no anemia, no PIH, no infection during antenatal period. So all these rules everybody should tell them. So the first important rule which we tell them is avoid physical relations. That is something which they can practice in their life. Avoid physical relation. Prostaglandins are very abundant in semen, and prostaglandins are the chemical which we use for contractions, abortions, and delivery. So for four-leg animal, nature has given them sense. After the female is pregnant, the male and female will not come close. So we tell them in this way, and usually they follow it. Second important thing which can cause contraction and abortion and preterm labor is if they lift some heavy weight. Okay, so they should avoid lifting heavy weight. These are the simple thing you'll if you tell them simple things make big difference. Avoid lifting heavy weight, and you have to tell them specifically that the heavy weight means more than 1.5 kgs. Avoid lifting weight more than 1.5 kgs. So we experienced it. That lady told us that a bucket is not a heavy weight. Then since then we started telling no, it's 1.5 kgs. Wherever you want to apply pressure from your stomach, जीव खाऊं उछलाए लगता, then पेट से जोर लगा के उठाना पड़ता है, then it's going to affect. Sometime it will cause abortion, sometime it will cause preterm labor, and if it repeatedly happens, surely it might lead to some adverse event. So don't lift weight more than 1.5 kgs. Simple thing. You don't want preterm delivery, like your friend had, your colleague had, you are anxious about it. Simple thing. Don't have relation, don't lift weight more than 1.5 kgs. Anything else we can do about it? Yes. Constipation is very common problem in the pregnancy. Okay. If her stools become stony hard and she has to force it out, same pressure will be applied on the mouth of the uterus. Simple thing. Don't constipate. How she is not going to constipate? Eat lot of salads. So I usually tell एक काकड़ी एक टोमेटो प्रत्येक जेवणात खायचा. So some fruit which is having a lot of fiber, they have to take in their major meals. Okay, so we are trying to avoid constipation, so we are trying to avoid abortion or preterm delivery. So, and at the same time they have to drink 200 ml of water, that is one full glass of water every 2 hours by clock. So a lot of fiber diet and adequate amount of water, they will not constipate, so the chance of preterm delivery or abortion will be low. Then there will be a problem of growth restriction. Growth restrictions, we will discuss this little later. Actions, and they can cause preterm delivery or abortion. So to avoid infection, there are 3 types of infections: respiratory, gastrointestinal, and urinary infection, which are very common in pregnancy because pregnancy is an immunocompromised state. In immunocompromised state, if they will catch infections very early, very soon, and infection will flare up like anything because the immunity is not curtailing it, and there are many good medicines which we can't give in pregnancy. So we have to stop infections. If they know how to stop infections, they know what all can they do to prevent this complication. So fear will be low. So to prevent respiratory infection, they have to avoid public places. Lagna, Munja, Barshe, they have to avoid public places. All public functions, gatherings, they have to avoid. So self-quarantine. Now, after this, COVID pandemic, we are telling this since 2012, but after COVID pandemic, that becomes very underlined, self-quarantine. Don't go into public place, don't go into a public transport, and you will not have any problem of respiratory infection. Then for gastrointestinal infection, you have to tell them, do not eat any outside food. The food which is prepared at your house and which is consumed within 3 hours of cooking is the best for you and your baby. So no hotel food is hygienic. You are invariably going to catch gastrointestinal infections. So two infections are over. Both these infections occur usually due to contaminated hands. And if they sanitize their hands every 2 hours by clock, either by soap and water or by hand sanitizer, then the 80% of these respiratory and gastrointestinal infections can be curtailed. And we are telling this since 2012. And with again COVID pandemic, that got underlined. Now, third infection is urinary infection, which is very common, which causes preterm labor and which causes preterm deliveries and prematurity in the baby. So, if they don't want urinary infection, what all they can do? The most important thing they can do is pass urine every 2 hours. So, if urine stagnate in the bladder for more than 2 hours, bacteria will start growing there. No, बहता पानी ठहर गया तो सड़ जाता है. That sort of thing. No, so pass urine every 2 hours, and you are supposed to drink 200 ml of water every 2 hours. So urinary tract will be flushed. There will not be any urinary infection. So these three infections, if curtailed, most of the patient will reach to full term without any problem. Okay. Now, apart from that, they have to avoid visiting any ill sick patient, because the patient will not get well, but these people might carry infection at home. And there is one more thing which we have to stress during pregnancy is adequate rest on the left lateral position. See, complications happen. What I have noticed is this one thing which is very important in outcome of pregnancy, because most of the ladies are now working ladies, and it is becoming difficult for them to work on all front, and rest, especially afternoon rest, is going down, which is causing a lot of problems in terms of pregnancy-induced hypertension and growth restrictions in the baby. So if we really want a good outcome, and that lady really want to remain fear-free about the outcome of pregnancy, she should not develop blood pressure. She should know the ways to prevent blood pressure rise, and she should know ways to prevent growth restricted babies. And if once blood pressure rises, it usually happens that the affair is at the 7th month. In 7th month, usually blood pressure start rising, and the only way to curtail that blood pressure is delivery. So if that BP shoots beyond certain limit, we have to deliver that mother, because unless that placenta comes out, that mother, that blood pressure is not going to go down. So usually it results into a preterm babies. So we have to prevent this problem, and by only one single thing we can prevent it. That lady must know that is going to keep her fear down. So previous pregnancy, she had a blood pressure rise, and baby was delivered at 28 weeks, 30 weeks, and baby was in the NICU for 2 months, and it punched a large hole in their savings, and baby again, she had many issues about neurological development about the baby. She must have learned. Everybody's doing Google about every aspect of their pregnancy. So we have to tell them to prevent pregnancy rise, blood pressure rise during the pregnancy. What they can do is they can take adequate rest in the left lateral position. And what is adequate? My teacher usually used to recommend is 10 hours in the night and 4 hours to 6 hours in the afternoon. This is minimum basic rest they need to take. And what rest? What position? They have to take that rest on left lateral position. During the left lateral position, the kidney and uterus get adequate blood supply. If kidney gets adequate blood supply, blood pressure will not rise. If uterus get adequate blood supply, the growth restriction will not occur. Okay, so they know the way how to prevent blood pressure rise. They know how to prevent growth restriction, because they are invariably going to come to these facts from some books they are reading, or doing research on internet, that birth weight and IQ has a direct relation, and then they will be worried about the weight of the baby. So this is one important thing we should convey to them. And the last important thing during antenatal care is there should not be any nutritional deficiency in mother and baby, because nutritional deficiency in the mother is going to invariably going to lead to anemia, which is very deadly to the mother, because 50% of maternal mortalities are attributed to anemia. And Emcure has done wonderful job in field of anemia, curtailing anemia. We are very thankful to Emcure because they pioneered starting IV iron during pregnancy. No, it was there, but they took a lot of efforts to bring that IV iron sucrose and ferric carboxymaltose into daily practice, where they all consultant felt no ease about giving IV iron. And now we have to tell every hour patient that iron, calcium, B12, folic acid, and D3, these are the 5 basic things which every lady is going to be deficient on during pregnancy and during lactation. And these 5 elements, they are whatever they are getting during their food, good food will provide the amount 1/4 of what is required. They can't eat 4 times high, so they are going to be deficient. So it is best way to provide that adequate nutrition to mother and baby is to take supplements. So there is no alternative to iron and calcium tablet. Iron tablet must contain B12 and folic acid, and calcium tablet must contain D3, so that mother and baby will get adequate nutrition. Mother will not be anemic. Baby will not be low on the nutrition, which again affect their IQ. Okay. So these are the antenatal care. Basically, and the one more important thing, the tablet has to be continued for 2 years of baby's life. She has to breastfeed for 2 years of baby's life, because that's the IQ deciding time. Till the time 2 years, baby's brain is developing, and during that 2 years of life, if the baby is low on the nutrition, these 5 elements, then there are scientific studies which state that the IQ will fall down below genetically programmed IQ. So 2 years of life, the mother will take tablets and deliver those vital nutrients through breast milk to the baby. Okay. So intrapartum pain and LSCS, we have to convince them. The pain will be there, but there are various methods which we can curtail the pain with epidural analgesia. There are various methods. Give them some backup plan. If there is epidural analgesia, then you will not have that pain, and you have to convince them. You have to read about epidural analgesia, you have to tell something about epidural analgesia. Then the delivery, then you have to tell about the route of delivery. The route of delivery should not matter nowadays, because we are more worried about the outcome of the baby rather than route of the delivery. But you have to tell them that, okay, 70 to 80% female will deliver normally, 20-30% female will require cesarean section because of various factors, and you should not be adamant about it. No, delivery has to be normal. So counseling that will end her intrapartum worries. Postpartum period, it is important to detect any postpartum blues or depression. Postpartum psychosis, relatives will, they only will tell you that the lady is talking irrelevant. But depression and postpartum blues will go unnoticed most of the time. So you have to teach her that, okay, these are the sign symptoms. You will feel irritated. You will feel, like crying for all small things. You might feel like that. If you feel like that, report us. We will treat it. It's an easy to treat condition. It's a temporary condition. If we treat it, you will take care of yourself and your baby in a better way. So counseling is important regarding these diseases, postpartum blues and postpartum depression. Taking care of baby during postpartum period is important. Lactation is important, and you have to just reassure, tell them that nature has taken care of everything. You just put finger in the baby's mouth and it has to suck. Nature has given baby so good reflexes that it's going to take care of their baby, and you just need to latch your baby to the breast and sit tight for half an hour, and baby lactation will be established. Don't worry about it. And finally, sudden mishaps. So babies are prone for infection, babies are prone for aspiration, and babies prone for hypothermia. These three important preventive methods you have to tell them while they go home from the delivery. So for hypothermia, you have to tell them that you have to keep your baby warm, wrapped, when especially hypothermia occur post bath. So usually in our traditional setup, babies are massaged with oil so that the water will not stop on the body for a long time, and it will not cause hypothermia. Especially on the head, they used to put a lot of oil so that the hair will not catch water, or the head surface area is the largest surface area that will not carry water for a long time, and baby will develop hypothermia. At the same time, you have to tell them to cover the baby's head with layered cloth double layer cloth, and you have to keep baby warm. There are very good tradition in India, like putting that charcoal, red hot charcoal in the room after delivery, so that the room will be heated, and baby will not develop hypothermia, especially after the bath. Then for infection, you have to follow all those rules which mother has followed throughout the pregnancy. Don't go outside, don't go into public places. That also traditionally is followed in Indian culture, that after delivery, the people who are having they people from the family will not go into public function. Vital part they will not go into public function. The mother and baby will not be exposed to many people after delivery, and there will be we usually tell the hand sanitize every time before they touch to the baby, and keep baby and mother away from all infected people. If somebody is infected in the family, get the treatment as early as possible. And last is aspiration. After breastfeeding, you have to take your baby and birth it every time, even at 2 o'clock at the night, and aspiration will be avoided. So these are the common problems which are encountered during pregnancy, delivery, and lactation. And if they are aware about what is coming to them, and if they are aware about ways to deal with it, their fear will be low, their anxiety will be low, and if they know how to deal with, and then there will not be any depression whether I can manage it or not. So finally, uh, you have to assure them that a pregnancy or labor or postpartum period is a physiological thing. Most of the ladies will pass through these phenomenon uneventfully, and things will be smooth for you. Okay, thank you very much for Emcure and Symbiosis for giving me opportunity to speak about it. I just talked about normal patients who are going to face delivery and labor. Psychological problems during pregnancy, that diseases during pregnancy, a separate topic. I can't cover it during this session. Thank you.
Thank you very much, sir, for a wonderful session. Session was very scientific and informative. There are few comments or questions from audience. Can we go ahead, sir?
Yeah, please.
First question is like how psychological condition of mother will affect the baby's health.
Okay, so most important, you see, all these rules they have to follow, no? Like traffic rules they have to follow, and if traffic rules are followed, then there is less chance of accidents during driving or during travel. Likewise, all these rules has to follow during pregnancy. If mother is psychologically sound and she understands the importance of these rules, and she has a willpower to follow these rules for the baby, then all these complications will not occur. But if mother is not sane, mother is not in her senses, and her problems, other problems are overriding her emotions, and she doesn't follow all these rules. Suppose some lady she can't control the urge of eating outside, or she can't control the going into parties and drinking alcohols, or doing some sort of addiction. Then these are the people who are psychologically disturbed people. They are trying to find out the happiness from outside things. Then if that is the case, these people will invite trouble, invite all sort of complications. And psychological health, it is commonly said in Indian culture that if somebody is pregnant, you have to keep her happy. If she's not happy, if she's fearful, she's anxious, she's depressed, it's going to affect her baby's outcome. Now this is being seen because India is having population explosion, and everybody has to work. Even ladies who are traditionally working in the house and rearing kids, now they are entering into uncertain jobs, and it is causing a lot of stress on their mind. Apart from the family responsibility, they have to take all these responsibilities, and the stress is causing multiple complications in the pregnancy in terms of pregnancy-induced hypertension, gestational diabetes, growth-restricted babies, preterm deliveries, various infections which they encounter when they go out, and all other problems. The pain threshold is very low because they are already exhausted their energy. They can't face that pain, and LSCS incidence is also increasing just because they don't want to face that painful episode. Okay, so all sort of problem will occur if lady is not mentally sound during pregnancy, and there are many researches going on whether it is going to affect the baby's psychology also, but that is not yet confirmed. But it is said that if mother is disturbed, then baby will be born disturbed psychologically. Okay.
The next question is, please explain how to take care of baby when mother is undergoing the depression or trauma.
Okay, so when mother is undergoing depression or trauma, first important thing, see, no one can take place of mother. You cannot replace mother. So simultaneously, you have to take care of. Fortunately, in Indian culture, we have all those old people in the house who has faced pregnancy and delivery, who knows how to take care of babies. The simple things which are required to take care of baby is like cleaning baby or keeping baby warm, or feeding baby. These things can be done by anyone in the household, but the mother and baby bond is important. The most important thing one can do if mother is depressed is to treat her depression. Take her to the psychiatrist, or at least gynecologist should be very watchful about the postpartum depression. I usually on rounds ask these things to every of my delivered lady. रडायला येतं का, चिडायला होतंय का? Do you often cry, and do you get are you becoming short tempered and you're getting irritated because of any small things? If that is there, it's a simple thing to treat. You can counsel them. If counseling fails, then selective serotonin reuptake inhibitors will take care of her depression, and she can take care of herself and at the same time her baby. Taking care of baby in terms of food and other cleanliness is not a difficult task, but you can't replace the mother. The bond between mother and baby is crucial for baby's every aspect of development.
Thank you very much, sir. Rest all comments are like a very good session, informative session. Session was very informative, and looking forward for more sessions like this. And there is one announcement that the certificate will be distributed during the last session of Emvidya, which is scheduled on 19th of February. So please join us and make it memorable. And it is my humble request to all participants to please feedback for feedback form on RX platform. That's it. And can I conclude the session?
Yeah, please. Thank you. Thank you very much.
Thank you. Thank you very much, sir. Today's Emvidya session was very scientific and comprehensive. We have got lots of information tips about the how to take care during the pregnancy, after the delivery of baby, mother and baby health related to the psychological conditions and everything. And I extend my deep gratitude towards the esteemed faculty of this program who made it very interesting. I also thank all the participants for attending us, joining us, and encouraging us. Thank you very much. Thank you, everyone, for your kind support. Have a great time ahead.
Thank you, sir. Thank you, sir.
Thanks a lot for wonderful deliberations.
Thank you so much.
We can stop the streaming.